and welcome to Medical Dialogues. I'm Anshika Mishra, here's what I bring to you from the world of medicine. Researchers uncovered blood flow regulation of brain pericyte development. In a study published online in the Cell Reports, D.U. Julin groups at the Institute of Neuroscience Center of Excellence in Brain Science and Intelligence Technology of the Chinese Academy of Sciences and the collaborators created a zebrafish model for in vivo labeling of brain pericytes and systematically explored the developmental dynamics and brain pericytes during the early embryonic stage. The researchers revealed the promoting effect of blood flow on the proliferation of pericyte after ingress into the brain and showed that this process relies on the activation of mechanosensitive ion channel piezo1 in vascular endothelial cells and its downstream Notch signaling. Brain function relies on a complex and effective vascular network that provides necessary nutrients and removes waste products. To maintain the homeostasis of neural tissues and normal neural activity, the brain vasculature forms the blood-brain barrier BBB during development, strictly controlling substance exchange between blood and brain parenchyma. Abnormalities in the BBB are closely associated with various brain diseases such as Alzheimer's disease.
Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possesses in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below.
Preeclampsia and preterm birth risk may be reduced by calcium dose lower than current WHO standard. According to true trials of 11,000 pregnant women in India and in Tanzania, low-dose calcium supplements, that is 500 mg per day, appears as effective at reducing the risk of preeclampsia and preterm birth as high-dose calcium supplements, that is 15,000 mg per day. The study was published in the New England Journal of Medicine. The World Health Organization currently recommends high-dose calcium supplementation, equivalent to 3 calcium pills a day for pregnant women in context with low calcium diets, predominantly low and middle income countries. Lowering the pill burden to 500 mg calcium per day would reduce adherence barrier for women and reduce cost for governments and health programs without sacrificing health benefits. While calcium supplementation is a known intervention to help prevent preeclampsia and preterm birth, it is estimated to halve a pregnant woman's risk of developing preeclampsia and reduce an infant's risk of being born preterm by 25%. The study is the first to evaluate the efficacy of a low-dose regimen versus a high-dose regimen. The findings provide an opportunity to revise the WHO's current recommendation that women with low calcium diets, most women who live in low and middle income countries, receive high-dose calcium supplementation throughout pregnancy. Black people face strokes at higher rates younger ages than white people. Black people consistently had a higher rate of stroke than white people over a recent 22-year period, according to a study published in the January 10, 2024 online issue of the Neurology, the Medical Journal of American Academy of Neurology. The study also found that the average age of black people experiencing stroke was nearly 10 years younger than that of white people, another inequity that grew over time. We found that the rate of stroke is decreasing over time in both black and white people, a very encouraging trend for the US prevention efforts, said study author Tracy E. Matson, MD PhD of Brown University in Providence, Rhode Island. But there was an inequity from the beginning of the study, with the rate of stroke always being higher for black people than their white counterparts. The disparity did not decrease in 22 years, especially among younger and middle-aged adults. Researchers evaluated stroke trends over time using data from hospitals in southern Ohio and northern Kentucky from 1993 to 2015. Stroke cases were recorded across a full year every 5 years, about 1,950 cases per year for a total of 9,728. Using US Census data, they were able to calculate stroke incidence rates per 100,000 people. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.